The Indian healthcare industry, for them, I think it has been a shock, in all honesty. And nobody realized the expanse, the intensity, and the extent of the problem, the size of the problem. And I'm saying this because, we're looking at the so-called developed nations, and they're grappling with huge, huge problems. So the Indian healthcare, the sector at large, surprisingly have come together so well. We must give them credit for it. Both the government and the public sector, the private sector have all come together saying, let's formulate methodologies to handle this problem. Let's work together to see how we can tackle the problem, and let's learn from each other. And I think that's the way the industry has come together. In terms of infrastructure, if it's a full-blown issue, if we extrapolate data, which we're getting, global data, we could have a problem. But I think the norms and the measures which have been put into the country are simply, the awareness. We're talking about social distancing. We're talking about this 21-day lockdown. I think all this is going to make a huge difference in flattening the curve. There's no going away from it. It needed to be done. The Prime Minister took like a call to do it. And I think that is literally going to save a lot of lives, save 1 million lives maybe, we don't know. But having said that, the industry per se, in hindsight, maybe it could, we could have helped it grow much more. And that in a way comes with a sense of regret, that if healthcare industry had really been given the infrastructure status, had really been given the kind of request they had asked for, it wasn't anything much at all. If you look at the amount which they're doing now, if we had really nurtured the industry, if we had really nurtured private sector healthcare, we could have been such a strong force. But we still are, and we've come together, which is probably the best thing which has happened. There's so much of innovation, indigenous replacements for things which we were traditionally importing, and I think that's a good thing. People are trying to see how can they solve the problem by doing whatever they're doing, by doing it better. Can we really use algorithms to catch disease much earlier? Can we create awareness using, social media, using AI? So a lot of very smart techniques, technology has come in, and I think industry is kind of coming together to do things like that. So if you ask me, is the Indian healthcare industry prepared for this? My answer to that would be that Indian healthcare as an industry, as a sector, is so much more prepared with all the constraints they have than many other countries who had everything and who had deep pockets, huge budgets, and they were not prepared. So I would give, on a scale of 10, Indian healthcare industry at least an 8 for the way they're coming together and coping with this. And at this point, I'd also like to say that the government support from the health departments of the states, of the center, Niti Aayog, has been tremendous. You can talk to them any time of the day. They're available 24/7. So I think we must give them credit for that. So we will fight the war, and hopefully there won't be too many casualties. I hope there's never anything so disastrous in the future. But having said that, maybe we could be more prepared with materials within our system. My biggest concern or worry is probably the fact that we're not able to test enough. Private sector is gearing up to test patients who are going to require it. But we don't have enough reagents, and we all know that. Could we be prepared in such a way that if there is a global lockdown, can we be 100% self-sufficient? Would probably be the single biggest wish or request I would look for. We are trying to see how can we, have more supplies of the PPEs, which I'm sure there will be an answer, but right now it is a concern. Some of the large corporates in the country have come together saying that they will manufacture ventilators, which again is wonderful. So I think preparedness going forward, this was so unexpected, but maybe we have to prepare for all kinds of biological issues happening, or force majeure, or like the tsunami happened. I mean, no one prepares for such horrible things, and we can only work much harder, I guess. So I think how have they responded to the problem? Extremely well. The government took a call to scan visitors while coming in. Very well done. Took a call for a lockdown. Very well done. Are people educated enough to handle the problem? Not enough. People need to know that it's their problem and not the government's problem. And I think that communication could be stepped up so much more. But going forward, the huge realization has dawned on all of us that a stable economy needs a stable healthcare backbone. And healthcare as such needs to be frankly looked after and nurtured. Because at the end of the day, they're the heroes who really stepped in. Gods in white coats is what they were called. But are we doing enough to develop a healthcare system for the future? I don't think we're doing enough as a country. It needs, it's better than what it was, I guess, but there is so much more to be done. Can we fast track that? Can we fast track that thought process without this huge cloud of suspicion on private sector healthcare? Would really, really make a big difference. In every business, in every industry, there may be a few offenders, but that does not mean that the whole industry at large is bad, because healthcare is a responsibility. Healthcare we need to do for the common man, we need to do for ourselves, and we need to do because people from overseas, they value us and they look at us. So I think the sooner we get healthcare as a business, as an industry, more than anything else, we're in the business of caring. And if we can get it back on its feet, because right now the threat of shutting down looms very large, very high and very large on our radar. So can we do something to really look after the industry so that it gets back quickly on its feet, because otherwise we can't serve the nation. And also we must remember that 70 to 80% of India's healthcare is in the private sector. You cannot allow that tree to die. You have to see that it flourishes. So please, biggest request is to do something for private sector healthcare, because otherwise healthcare in the country will collapse. The public, number one, should not panic, because if you panic, things can get out of hand. There have been very clear communication. There's been a dikkat which has said, be careful, social distancing, practice hygiene, just do whatever's been told. In other countries, and I love Singapore as an example, they are so disciplined as a country and as a race. If we had even 50% of that kind of discipline, we'd do so well. So I think the public has to trust the private sector healthcare, has to trust the government sector healthcare, and say that, they're here to help and to look after us. Let us just listen and have faith, and this too shall pass. We need to flatten that curve. We need to break that chain. I think the healthcare fraternity is trying to do everything they can in this almost impossible situation. My appeal to them is that, please communicate the right things to do, because people look up to the healthcare fraternity, whether it's the doctors or the nurses or the support staff. And if somebody working in healthcare says something, people will listen. So please communicate the right things. Please rise to the challenge of looking after people in our nation. Please look after the vulnerable population because they need extra care and extra TLC. And just to do that, don't go out there and don't crowd the place. So I think that also is important. If one person can do a job, let one person do it and not 5 people do the same job. So I think that would also be something wise for us to do. So let's think about that. But if we were doing very well in terms of output and productivity, we just have to do 10 times